I've been a community health worker for 3 years.
I've been a community health worker for the past 8 years.
I've been a community health worker for 9 years.
Over 10 years as a professional CHW.
I have been a community health worker since 2012, so about 10 years now.
I've been a community health worker for more than 20 years. I would say a community health worker connects the community to care. It could be in many forms, connecting to food or services, mental health services, or transportation.
Someone that can be there for you, someone that can explain things to you, and someone that can give you that extra 15 minutes that you might not get with a provider when it comes to education, whether it is about your visits or it is about something that mainly related to your social examination of health.
And so a community health worker can help guide them in the direction of making the right first steps to get to where they need to get and the resource that they need. So a typical day in my role is a phone call or a drop-in by a community member, fishing industry worker, basically coming in to ask for help with health insurance, plan selection, recovery services, primary care recommendations, pretty much anything that they would need help with, they come in for.
My role is to assisting patients with accessing services, which include PT1 service to medical appointments and other services in the community like buses or vans. And then I also educate the providers and any other staff at the clinics. That's my job.
I advocate and navigate at the same time.
During the pandemic, I feel like housing in general, it still was a major issue, but because of everything being shut down, it was a struggle to get people connected, right? And people, were coming behind in their rent, so financially unstable, back rent. And there was a particular family, the child had medical components and then the father was our patient at Boston Medical, and the child was, I think, Children's Hospital. So it took a lot of collaboration between the hospitals, the housing. They were in a shelter for over 2 years, a hotel shelter. So getting that family a unit, that was a pivotal moment in their, in their care, because not only did the father get his needs met, and then the child, and it needed to be an accessible unit. They had to restructure a bathroom and a public housing unit, so it would be a roll-in shower. So it just took a lot of effort and from a lot of different organizations, and I just feel like that was a very proud moment to get this family housed that has been homeless for over 2 years.
I have an older gentleman that I've been working with from the time that most everything shut down. He doesn't really understand computers, emails, logins, things like that. One of the things that started for a lot of fishermen was access to the pandemic unemployment. And so what we were doing and what I did for this gentleman was help him set up his account. So on a weekly basis, we would set up a call on Monday morning so that he could walk through the steps of logging into his account and submitting a claim.
I would definitely want people to know of the importance and the value of having community health workers and the impact that they have and the crucial role that they play in providing services and care for families and individuals.
I just love to be able to help someone get into a better situation than where they're at, or maybe a different situation than where they want to be, or whatever that is. But it's just a cool job to have.
I always say, like Maya Angelou said, people will not remember what you say, they will not remember what you did, but they will remember how you made them feel.
Hi, everyone. I'm Attorney General Maura Healy. I want to thank the Massachusetts Association of Community Health Workers for inviting me to be part of this year's Community Health Workers Day and to share with you my deep appreciation for all that you do. Community health workers play a critical role in improving the health of families and in reducing health disparities. This month, we get to highlight some of the amazing work that you do. You are the health equity workforce. You're the trusted advocates, educators, and public health workers. Day in and day out, you are bridging the gaps between our communities and our healthcare and our public health systems. We know that especially over the last 2.5 years, we have asked so much of you. During the pandemic, you've shown nothing but compassion and resilience, supporting your communities through crisis, even as you had your own families to care for. Thank you for your tireless service and commitment to community health.